People who are physically active, unfortunately, from time to time you can suffer a knee injury. What we'd like to talk to you about is the mechanism of injury, some of the acronyms that are used if you come into the clinic, perhaps some tests that will be used for you and could lead up to surgery. But before we get there, let's talk about a few things first. Basic anatomy of the knee. Sometimes people say, well, I tore my ACL, and some people don't know what that means. Well, that's the anterior cruciate ligament. If this is your thigh bone and this is your lower leg, all the anterior cruciate ligament is, it's a ligament that goes back behind the knee, and it helps to prevent the lower leg from coming forward. It is pretty big, it's pretty thick, so if you do injure it, it can be very debilitating. One thing we want you to be aware of all the other structures of the knee, different mechanisms can impact that. For example, if you twist a twist mechanism, you can tear the cartilage, which is the cushioning between the upper and lower legs, bones. And you can have the lateral and medial collateral ligaments. They offer some stability. Sometimes people get hit from the side, they fall, plant wrong, you hear a pop. Sometimes it can be an indication that there are some problems. Obviously, swelling, pain, you feel a locking in the joint, it doesn't feel right, it hurts to stand on it. Those are all symptoms that might indicate you need to come see one of our physicians. We do want to talk about, obviously we talked about it before, about using elastic wraps to help support an injury site. Obviously the knee is a big joint, so when you do try to wrap it, make sure you wrap above and below the knee so you can provide support, not just right in the joint, but above and below it can offer enough support. Ice is always best. Try to keep it elevated, try to keep off of it. We also advise you to use crutches. For example, you know that there's different sizes of crutches. This, for example, is a tall adult. It's easily adjustable. A good item to have at home in a first aid kit. This is just a regular adult size, pre-fitted for someone my height. You see that the hand will carry a bulk of the support. Sometimes if you can put 2 or 3 fingers under there, that's a good indication it's measured correctly. You've seen those people that have put towels up there. That's because they're trying to put too much support on this part here, and it irritates. A bad way to fit a crutch, too much gap. So you can see how it's easily adjustable from here and from the bottom to be comfortable for you to walk around on. You come see our doctors, they may put you in a straight leg immobilizer. It simply goes around the leg to help keep the joint straight until they can do further diagnostic tests. Remember, an x-ray will just show the condition of the bone or the joint. It doesn't show any ligaments or tendons or anything like that. That's why sometimes the doctors will order what's called an MRI. It's a fancy type of x-ray. It is easily done here in our clinics, and is a very, very good diagnostic tool. Sometimes the doctors may put you in what's called a post-op brace. This is a hinged metal brace that the doctor can actually set it or lock it in full extension or allow you some movement depending on the type or severity of injury that you have. Let's say you've gone past that, you're starting to recover. There are other DME equipment or durable medical equipment goods that we have. This is just a knee sleeve that you slide up, and it does have a hole for your kneecap or the patella. This is a different form where it does offer a little bit of more support on the sides. You simply Velcro it and your kneecap pops out right there. Pretty easy to use. Sometimes the condition may require additional stabilization, and that's what these pieces are. They are included in, you do put them inside. For example, this donut pad can fit inside and offer more support for the patella. And this horseshoe pad can be put at different locations to also provide support. Sometimes your knee condition may just be a patellar problem, and they will use what is called a choke pad, or it's like a fancy rubber band that goes at the base of the kneecap to offer some stabilization. But whatever your condition is, we want to remember that when you feel a popping, a clicking, you see discoloration, swelling, pain like you've never experienced before, your knee locks, it doesn't want to go straight out, these are indications that you should come and see one of our fine physicians here. I hope the information is useful to you. Remember, use ice, not heat, for the first 24 to 48 hours until you can get in to see our doctors. Remember, rbjc.com.